Watch for a runny nose, sore throat, and other cold-like symptoms. Check with a doctor because it may just be a cold. Most types of coronavirus cause mild to moderate cold-like symptoms, which generally don't last much longer than a week. You may have a common coronavirus if you experience symptoms such as a runny nose, a sore throat, coughing, headaches, a fever, tiredness, or a general feeling of being unwell. Make note of headaches and body aches. Some coronaviruses, such as the virus that causes SARS, severe acute respiratory syndrome, can cause flu-like aches and pains. Be on the lookout for headaches and pains in your joints and muscles, especially in combination with a fever or other flu or cold-like symptoms. Some people with SARS continue to experience muscle and joint pain and stiffness even after the other symptoms have cleared up. Check for a fever. Severe forms of the coronavirus, such as SARS, MERS, Middle East Respiratory Syndrome, and the new China strain 2019 nCoV, often start with a high fever. Check for a fever of 100.4 degrees Fahrenheit, 38.0 degrees Celsius, or higher. You might also experience chills or episodes of sweating along with the fever. Look out for a cough and shortness of breath. Some forms of coronavirus, such as SARS, MERS, and the novel coronavirus recently identified in China, are characterized by severe respiratory symptoms. These symptoms typically include coughing and shortness of breath, along with a fever. With SARS, the cough tends to develop within 2 to 7 days after the initial symptoms, such as fever and body aches, begin. The cough is typically dry. Many patients with MERS or SARS eventually develop pneumonia, which can include symptoms such as chest pain during breathing. Pay attention to diarrhea or vomiting. Sometimes coronaviruses can cause gastrointestinal symptoms as well as respiratory problems. You may have a coronavirus if you have symptoms such as nausea, vomiting, or diarrhea, especially if you also have a fever and respiratory symptoms. Gastrointestinal symptoms show up in about 10 to 20% of people with SARS. Diarrhea and other gastrointestinal symptoms can also occur with MERS. Call your doctor right away if you think you have a coronavirus infection. A coronavirus infection can potentially become deadly, especially with a serious strain such as MERS, SARS, or 2019 nCoV. If you have recently been exposed to a person or animal with a coronavirus infection, or if you live or have traveled in an area where these viruses are active, contact your doctor immediately if you start to develop symptoms. Let your doctor's office staff know that you think you may have a coronavirus infection before you arrive. That way, they can take precautions to prevent you from POT. Allow your doctor to test you for a coronavirus infection. If you have severe symptoms or if they suspect you may have contracted MERS, SARS, or a novel coronavirus, your doctor may recommend a laboratory test to confirm your diagnosis. These tests typically involve taking a sample of your blood, sputum, saliva, and phlegm that you cough up, or material from a swab inserted into your nose or throat. In some cases, your doctor may want to collect a stool sample for testing. Follow your doctor's home care instructions carefully. There's no specific treatment for coronavirus infections yet. If your doctor diagnoses you with a coronavirus, they will likely send you home unless you have severe symptoms that require hospitalization. Ask them for instructions on how to care for yourself and prevent the disease from spreading to others. Your doctor may prescribe or recommend medications to treat your symptoms. There are no medications that can kill or cure the virus itself, so all you can do is take care of yourself and wait for it to run its course. Stay home and rest as much as possible. Getting plenty of rest is vital for helping your body fight the infection and recover. Additionally, staying home will help prevent you from spreading the infection to others. While you're infected, stay home from work or school and avoid strenuous activities around the house. Get as much sleep as you can. Ask your doctor for advice about when you can return to your regular activities. They may recommend waiting for up to 10 days or even longer after your symptoms have cleared up. Take over-the-counter medications to manage pain and fevers. If you have symptoms such as body aches, headaches, or a fever, you can get relief with medications such as acetaminophen, Tylenol, ibuprofen, Motrin, Advil, or naproxen, Aleve. If you are over 18, you can also use aspirin as a pain reliever and fever reducer. Never give aspirin to children or teens under 18, since it can cause a potentially fatal condition called Reye's syndrome. Always follow the dosing instructions on the label or given to you by your doctor or pharmacist. Use a humidifier to ease a cough or sore throat. A humidifier can help soothe your throat, lungs, and nasal passages. Set one up by your bed at night and wherever you spend most of your time resting during the day. Taking a hot shower or sitting in the bathroom with the shower running can also bring relief and help loosen up mucus in your lungs and sinuses. Drink plenty of fluids. It's easy to get dehydrated when you're sick. While you're recovering from a coronavirus, keep sipping on water, juice, or other clear fluids to fight dehydration and loosen up congestion. Warm liquids, such as broth, tea, or warm water with lemon, can be especially soothing if you have a cough or sore throat. Get emergency care if you develop severe symptoms. Some types of coronavirus, such as SARS, MERS, and 2019 COVID, can develop into life-threatening infections. Go to the emergency room or call emergency services if you develop severe symptoms, such as difficulty breathing or chest pain when you breathe. The most common complication of coronavirus infections is pneumonia. Symptoms of pneumonia include chest pain, coughing, high fever with shakes or chills, difficulty breathing, fatigue, and nausea or vomiting. Some severe types of coronavirus, such as MERS, can also cause kidney. Limit contact with infected people as much as possible. Many strains of coronavirus can be spread from person to person. If you know or suspect that someone is sick with the coronavirus, avoid close contact with them as much as you can. Always wash your hands thoroughly if you have to touch an infected person, and consider wearing a mask around them. You can get a coronavirus infection by coming into contact with particles in an infected person's saliva or mucus, such as when they cough or sneeze near you, having close personal contact with an infected person, such as hugging. Stay away from farm animals and wild animals. Many coronaviruses are spread from animals to humans. The most common animal carriers of coronaviruses are civet cats, in China, and dromedary camels, in the Middle East. If you come into contact with animals of any type, especially in areas where coronaviruses are a problem, always wash your hands carefully. Be especially careful to avoid contact with animals that are obviously sick. Most cases of MERS are caused by contact with infected camels. Coronavirus transmission between animals and humans is considered rare. Cook meat and other animal products thoroughly. You can get coronavirus infections and other diseases from consuming contaminated or poorly prepared meat or milk. Avoid eating raw or unpasteurized animal foods, and always wash your hands and any surfaces or utensils that have come into contact with raw or untreated meat or milk. Wash your hands regularly with warm water and soap. Hand washing is one of the best ways to prevent the spread of coronavirus and other diseases. Use warm water and soap frequently throughout the day to clean your hands, especially after touching surfaces in high-traffic areas, such as doorknobs in public bathrooms or handrails on trains and buses, or potentially infected people or animals. Wash your hands for at least 20 seconds, and be sure to clean between your fingers. To ensure you're washing long enough, try singing the Happy Birthday song while you wash your hands. Avoid touching your eyes, nose, and mouth. Respiratory viruses like those in the coronavirus family get into your body through the mucous membranes in your eyes, nose, and mouth. You can protect yourself by keeping your hands away from your face, especially if you haven't washed them recently. You can get extra protection by wearing a face mask in areas where the virus is active. Clean and disinfect all objects and surfaces a sick person has touched. If you or someone in your home is sick with the coronavirus, prevent the disease from spreading by cleaning anything they come into contact with. Use 1 cup, 240 milliliters, of bleach mixed with 1 gallon, 3.8 L, of warm water or a disinfectant wipe or spray to keep things clean. Make sure the surface stays wet for about 10 minutes for the disinfectant to work effectively. Clean any dishes or utensils immediately with hot water and detergent. Clean any contaminated linens, such as sheets and pillowcases, in hot water. Cover your mouth whenever you cough and sneeze if you're infected. People with coronavirus infections spread it by coughing and sneezing. If you have the virus, you can keep other people safe by using a tissue, handkerchief, or face mask to cover your nose and mouth when you cough or sneeze. Throw away any used tissues immediately and then wash your hands in warm soap and water. If a coughing or sneezing fit catches you by surprise or you don't have a tissue on hand, cover your nose and mouth with the crook of your elbow instead of your hand. Pay attention to travel advisories if you plan to visit other countries. If you're planning to travel abroad, visit your country's travel website to find out if any dangerous strains of the coronavirus are active in the area you plan to visit. You can also check the website of the CDC or the World Health Organization for information. These websites can offer advice about how to protect yourself while you travel. The Centers for Disease Control and Prevention and several other health organizations around the world are currently monitoring an outbreak of a new coronavirus in Wuhan City.